If I was explaining the heart to a child between the ages of 8 and 10, I would tell them that the heart is an organ located within the thoracic cavity, which is in the thorax region or the upper abdomen. It is also within the rib cage, and the ribs act as protectors of the heart and other organs in there. The heart is important because it pumps blood throughout the body, and it does that by contractions. And the heart itself is a muscle. It's made up of the kind of muscle called involuntary muscle that contracts and expands without us like trying to make it contract or expand. And the blood that is circulated throughout the body is oxygenized, meaning it has the molecules that allow us to breathe within the blood. Another part of the thoracic cavity is the diaphragm, which allows the lungs to expand and contract, and that's important because the lungs and the heart work together to get oxygen-rich blood into the bloodstream and take deoxygenated blood, which is blood filled with carbon dioxide, which is bad for you, out of the bloodstream. If I was explaining it to a high schooler, I would tell them that the heart is just like to the 8 to 10 year old, it's located within the thoracic cavity and it's encased by the rib cage. Again, the ribs are very, very important because they help protect everything inside the thoracic cavity from outside harm. A couple major structures of the heart. So the heart is located in the left side, and there's the two of the most major parts of the heart are the aorta and the ventricles. The aortas are in the top part of the heart, or the inferior part, and then they're in the superior part of the heart, whereas the ventricles are in the inferior part of the heart. So the ventricles are inferior of the aortas, and so there's a right aorta and a left aorta. The blood enters through the right aorta, goes through a valve called the right atrioventricular valve into the right ventricle, and that's just the first part of the blood flow. But that's important because the ventricles are the main part, specifically the left ventricle, that contract the most to pump the blood throughout the body. And then the blood that is pumped out of the heart is transported through blood vessels known as arteries, and then blood goes through these things called capillaries, which is like a transition kind of into the veins, and the veins then lead back to the heart. If I was explaining it to a college kid, I would tell them that the heart is located in a compartment known as the mediastinum, which is located deep of the sternum and just left of the midline of the body. The bottom of the heart is also known as the apex. This is not to be confused with other organs, like for example the lungs. The top is known as the apex, but the bottom of the heart is known as the apex. The heart is also made up of 3 different layers. The first one, which is the most superficial, is called epicardium, and then myocardium is that middle layer, and then endocardium is that deep layer, which all makes up the fibers that make up the heart, which is as previously mentioned, it's an involuntary organ. The pathway of blood, it starts out by going into the right aorta, the right atrium, and then the blood then goes through the right atrioventricular valve into the right ventricle. It then is the blood then goes from the right ventricle through this thing called the pulmonary valve into the pulmonary trunk. And then after it goes into the pulmonary trunk, it goes to the lungs to deposit the CO2 filled, or the blood filled with CO2 in there. And then when it dumps off that CO2, it then gains oxygen. Then it goes to the left atrium, then through the left atrioventricular valve, then to the left ventricle. Then it goes out through arteries, circulates the body, and returns through the inferior and superior vena cava. And sometimes the heart has issues depending on certain health conditions of patients, and sometimes a transplant is needed.